Okay. First question is about, I already explained the project to you, but our first question is about the relevance and importance of occupation related to health and wellness. So first question is, how does choice or lack thereof in terms of reproductive health, sexual health, impact mental well-being?
Well, how does it impact? So how does being able to choose whether you have a baby or whether you, I mean, first of all, I see patients who've had, significant trauma. And so, part of the way you overcome trauma is being able to have some control of your own body and your own environment. And I think, if that choice is taken away from people, I think it makes them much more prone to feeling traumatized by other people in their world. I think, if you don't have choice over your own body, then you are always at somebody else's mercy. And that's kind of a trauma dynamic.
Okay. Also mercy. Okay.
I mean, I can say more. You just tell
No,
me.
that's fine. I mean, at the end of the day, we already have a lot of research that explains trauma-informed care and etc.
Yeah.
Okay. Next question is going to be about more about like the environment.
Yep.
So what are pros and cons of a hospital environment compared to home health in terms of treating patients? So like you're technically in a hospital environment. This is
Yep.
like,
I know.
just
Yeah.
going
Yeah.
in. Yeah.
Yeah. I know what you mean. I mean, I think the hospital environment versus home environment, I mean, I think there's pros and cons. I think the benefits of a hospital environment is that you can have like certainly more expert care, you can have more monitoring. It means that the other people in the home don't get inconvenienced or don't have to care for the person. What else? It gives kind of the whole system a break too, so that if like somebody is kind of very sick and they're at home, it kind of burdens the family as well. So it gives them a respite. It means like other people can, who are kind of more neutral, can be involved in care. I mean, those are the pros. Did you ask me the cons as well?
Yeah, also cons.
So the cons are that, you take somebody out of their home environment. I mean, I think that there's a lot of, actually, one of the things I'll say about telehealth is that being able to see people in their home environments has been just amazing in terms of kind of finding out like what their living situation is like, what their kind of social dynamic is like, whether they are living in a safe place. Like you can really learn so much more about a person by seeing them in their home. And it's so completely different because we never had telehealth, at least for me, we never had telehealth before the pandemic. So you just didn't have you just couldn't see it. Try and think of what else.
Would you argue that a hospital environment is better for a patient in terms of their reproductive health, whereas home health is better for mental health?
I don't really know. Like I have a hard time figuring out like where I mean, I think if they're in their home, like, do you mean if somebody's going into their home?
Yeah.
I mean, I think that maybe they'd be more comfortable talking about sensitive issues. So, being in their home environment, it might be easy to kind of access care. I mean, the one problem about having to go to a hospital is just the inconvenience of it all or, people can't always access care in the way that they need to. So like being able to get care in their home is very valuable in terms of, maybe they'd have more access to care. It would be more private. Trying to think of what else.
Yeah, that's great. Those are our main points. Why
Yeah.
that's like the whole point of our project.
Okay, good. Yeah.
Okay. So then,
I also think people tell you more when they feel comfortable and safe. And so, like, if they're at home and they haven't, like, going into the hospital is really stressful for people, or going like into the clinic. And so, like, being able to be at home, there's more comfort, and then they're more open about what they need and what they're up to.
yeah. Okay, great.
Yep.
Okay, we have 3 more questions. So
Sure.
next one is about birth control and STI treatment medications.
Yeah.
So to have access to those, most of them are not over the counter.
Right.
How does this impact the safety of sexual activity, knowing that they're not, these services are not provided over the counter?
Well, I mean, I think if they're not provided over the counter, and then a patient to access them has to like go someplace and get care, it means they're less likely to do it. Like, anytime there's a barrier, it decreases access to care. Like, I mean, so if they, like, I think if people could get these things over the counter and not have to like have a difficult conversation with a provider, but they could just like go and get it, like, it would absolutely increase, people's access to these things, and
Mhm.
increase their sense of safety and kind of personal choice, for sure. Is that what you mean?
Yes.
Yeah. Okay.
Let's see. Okay. Okay, next question is about, first of all, where have you worked that's technically rural?
Well, let me, like, I probably, well, there's one job. I mean, so are you, like, okay, so I've worked in a couple of settings. One, obviously, I worked in Burlington, Vermont, and I was a resident up there, and that was definitely more rural.
Mhm.
But mostly I saw people kind of in the hospital setting. Um, I'll tell you, there was one job where I would, when I worked at Maine Med, I worked as part of an assertive community treatment team. And the patients that we had as part of that team, like, we could go into their homes to see them.
Mhm.
And that was like really cool. I mean, you could definitely, like, people, you didn't have to wait for them to come to you. We could go to them and see them. And it really kind of improved the care that we could provide. But in terms of rural settings, I mean, I worked in Connecticut. I worked in at Yukon Health Center, which was in Farmington. That was pretty. I mean, it was rural enough. Where else have I worked?
Okay, that's fine.
Okay.
What was the treatment team called for Maine Med? Assertive community?
So it was called, it was the Action Program, and it's an assertive community treatment program. And so it's a model of care where the team goes to the patient. Like, if the patients could come into the office, that would be great. But if they didn't come into the office, like, they were an at-risk population. So the whole purpose of the team was that we could meet them in the community, we could meet them at their homes.
So what was the reason? What was the
The reason for
most
that?
common reason why they couldn't?
Well, because they were just disorganized, or they were, this was a patient population who was chronically suicidal and chronically, like, distressed, and just depressed and anxious, and just couldn't, like, get out of their houses or get out of their own way, or they were, for whatever reason, they were not compliant with treatment. And so they came to the team when their behaviors and symptoms were really high, and they had difficulty, like, accessing care by coming into the clinic. And so we could go see them. And so it was very cool, actually. I used to make visits to like group homes. I would go like, you know, I would go with the case manager, like on like a home visit.
Was it ever outside of Portland where you'd go?
No, not really. I'm just trying. No, it was pretty much Portland based.
Okay.
But it's the same theory. It's just that that's the population we met.
Yeah. So how do you think rural healthcare differs from urban healthcare? And
Well,
this is like your judgment, what you consider rural versus urban. Like I
I,
would consider Portland
yeah,
urban.
I mean, I imagine that I mean, rural healthcare, like,
Did it if you didn't notice any differences too, like how was
I think,
healthcare was?
the problem, Isabel, like off the record, is I've mostly worked in like Portland and cities. And so
Yeah.
mostly people just, it was like as part of I've always worked as part of a healthcare center. And I would say that probably in the cities, people lived closer by and they had an easier time getting to the places. But I'd say in the community or in the rural setting, things are spread out. And so people just have a harder time getting into the healthcare places. So I imagine access to care is probably the biggest thing you're running into in the rural setting.
Mhm.
Right? I
Okay.
mean, we kind of have to be because, things are spread out. People don't have the means to get places. Maybe they're turned off to going into a hospital or a clinic due to, they're just not used to getting health care, or they're embarrassed, or it's too private. And so they just avoid it.
Okay, so you think that a private healthcare system is a deterrent?
What do you mean?
Like if a person was to go to a private center, you think that that's a deterrent compared to like a public?
Oh, no, I meant private, like just like where there weren't like a lot of people around, like, or like, so they felt like the one problem with being in Portland and like my office, for example, is that it's very like there's a lot of people roaming around, and there's a lot of it's a little bit chaotic, and the patient population is pretty sick. And so people don't always want to come into the office. That's where, but I don't really know, honestly, I don't know a lot about rural healthcare.
That's fine. This is fine.
Yeah, okay.
Okay, then my last question is about, this is an opinion question.
Yeah, sure.
What are your thoughts about the overturning of Roe v. Wade?
Oh my God, I think it's a nightmare. And I think that I mean, we've taken so many steps back. So I think that, you know, it's, we have women who now can't make decisions about, I mean, not everyone, obviously, like there are some states who still will permit abortions, but I can't imagine like women being denied the right to make those decisions and having to carry a baby to term. And then what if they're poor? And we're not taking care of those kids. We're kind of forcing them on parents who might not want them. I mean, I think it's a disaster.
Okay. Have you seen it? Have you seen the effects of it in your
I'd, I'd
specific
say
work so far?
I'd say not yet really in Maine, but what I have, so I work with a lot of folks with PTSD. And so a lot of people, well, I'd say I work with a lot of people with PTSD, and I work with a lot of like the LGBTQ community. And so, really they're scared they're the next people to lose their status and lose their ability to choose. So I just think it's created fear in a lot of different populations.
Okay.
But I'd say that like the PTSD folks, a lot of them, who could have been sexually assaulted and now feeling like you have no choice but to stay pregnant by somebody who assaulted you, or you got pregnant by accident, you barely can survive now taking care of your family, and now you have like this extra burden that you didn't want. So I just think it definitely has ramifications for people who already feel vulnerable and they feel like, they can't make decisions for themselves anymore.